Hello everyone, I'm here with Dr. Kelvin Teo. He is a consultant at the Medical Retina Department of Singapore National Eye Centre and also the director of SERI Research Clinic. Welcome, Dr. Kelvin. First of all, congratulations on your doctorate. How does it feel?
Thank you very much. To be honest, it's a great relief to be done with this.
I'm sure.
You've done your PhD yourself, and I think you know that it's a ton of work, and really it's this big relief when it's all finished.
So, why did you first decide that you want to do a PhD?
That's a good question. Good question.
You have studied enough.
I think at the point where I decided to do my PhD, it was really down to an intellectual curiosity. I was doing some clinical research at that point, and what was most frustrating was that I couldn't understand why I was doing it, or the research methods, and I thought I needed something a bit more formal to give me that training in to know exactly what I was doing. So the story is actually I started out thinking of doing a master's in medical research, and that was funded by VisionSafe, so thanks to them. And as I was doing my master's, after the first year, my supervisor then thought that the scope of my work was enough for a PhD. So then he conned me into doing a PhD, essentially.
Conned. Okay. So what was it about?
So my PhD is on clinical research, so a little bit different from, I suppose, the traditional PhDs, which are a little bit more lab-based. So here I looked at big real-world data and how that influences our treatment patterns for age-related macular degeneration, which essentially is what I do in the clinics anyway.
Okay. So you're, based on your specialty, what are the kind of patients you deal with on a day-to-day basis?
So a large majority of the patients I see are patients with age-related macular degeneration. So my clinics are full of 65 and above, and they come in with quite devastating vision loss. And it always troubles myself, and I'm sure my other colleagues as well, as to the best way to treat them.
So can you tell us more in depth about what is age-related macular degeneration for our viewers here?
Sure. So AMD is a condition that affects elderly patients. And essentially, it is the degeneration of the retina, causing abnormal blood vessels to grow, and that would be the wet form of AMD. And because of this, it does affect the vision, especially the central vision. Now, of course, there are early forms of AMD where it really doesn't affect the vision, and that affects the majority of the patients. So this wet advanced form, really, it's just a minority. However, it can be very disabilitating for them in terms of vision. Now, the treatment is to get injections into their eyes. And the trouble is that the clinical trials that assess these treatments required quite a strict and quite a high treatment load. That's not attainable in real-world practice. And so really the crux of the entire PhD was how we could use real-world data, real-world outcomes to determine the best treatment patterns for these patients.
Okay. And what were some of the findings? Like, what do you think are the best ways to treat?
So I think there's a big push towards trying to personalize treatment for our patients. So it starts all the way from diagnosis, determining whether particular subtypes will respond better with a particular type of treatment or particular tempo. And essentially that was how the whole thesis was set out according to a patient's journey. So I started with diagnosis and subtyping. Then we looked at treatment patterns themselves, how frequent patients were being treated, at what kind of intervals, and how that might change for particular patients with particular biomarkers. And then the thesis went on to look at end-stage phenotypes of AMD. Essentially, these phenotypes are where treatment's no longer going to make any difference for them. And what risk factors in the patient's initial presentation or while they were having their treatment would result in these phenotypes, and how we could avoid them.
So do you think now that you're back to the consultation, your findings can actually help you in your...
Yeah, most definitely. I think what's really nice about this PhD is that it's very translatable to what I do in everyday work.
Great.
I think I've got a much better understanding of not only scientific methods and research methodology, but from all the findings, how to treat my patients better.
So since this was so interconnected, right, what were some of the challenges you faced? Like,
Well, the clinical bit wasn't too difficult because it was something I was doing anyway. I did foolishly my PhD while doing a clinical fellowship, so juggling that time was a little bit challenging. But I think the whole research methodology, scientific methods, was a whole different language. So while as clinicians, we're very familiar with medical terms and clinical jargon, but when it comes to research methods, statistics, for example, that was a real challenge. Having to pick up a book and study at a ripe old age of 35 was a little bit challenging.
so, but would you still advise other clinicians to go through the same experience you went through?
So I think if there is a strong curiosity to find out more about your particular field, definitely. I think PhDs or masters in research really does give you a good grounding in how you approach a research question. I think that's invaluable, and that was something I really appreciated. Otherwise, if you're happy to do clinical work, maybe not.
Any words of advice in hindsight?
Plan.
Planning.
Plan. So I think the entire course of 3 years is a long time. You really need to plan out when you want to be doing what. So in the first bit of the PhD, you could be looking at data collection, you had classes to attend. Then you really need to start planning for your thesis and write-up, and how to package that into a nice story so that you can present all your research findings coherently. I think my mistake was I didn't plan for my thesis, so it was a big scramble at the end, which I gather is quite normal and quite
absolutely normal.
common for PhD candidates. And advice from prior professors also was similar, that you should plan for your final write-up, but obviously I didn't heed that good advice. But really, that would be it. Just to plan out each stage. 3 years is a long time, so you do get lulled into this sense that I've got time. But really, you really need to make sure that you keep to that timetable.
Okay. So, what do you hope to do now, going ahead?
So I think with all this knowledge and this background, I think definitely to look at becoming a bit more of an independent principal investigator, to continue my research. But at the very least, I think I know now how to treat my patients better.
Great, very good. Congratulations once again. I think it's a very inspiring story for all our clinician scientists out there. And if they would like to tread this path, then we are hearing it from the man himself. Thank you, Dr. Kelvin Teo. I hope all our viewers had a few messages today from our interview with Dr. Kelvin Teo. And congratulations once again, Dr. Kelvin, on your PhD.
Thank you very much.
Thanks from
Thank
all our
you.
viewers. Yeah.